Welcome to June World Vitiligo Month. June is World Vitiligo Month. And my name is Cerinah Tugume. I run a business called Serene Beauty. And every June, we celebrate Vitiligo Month to support the journey of creating awareness about vitiligo and to bring encouragement and hope to people who have vitiligo. And with me here is Dr. Malik Ssempereza from Unity Skin Clinic. Please introduce yourself.
Thank you, Cerinah. Like you said, today we're celebrating Vitiligo Month, and it's something that I'm honored to be a part of the journey to raise awareness. I'm Dr. Malik Ssempereza. I'm a dermatologist. I've been practicing dermatology for the past 13 years. And vitiligo is something that I've been soaking on. It's something that I've seen impacting patients' lives. And it's something I would love to have more say in, especially in raising awareness. So so thank you for having me on this podcast.
Yes, it's really a pleasure to have this conversation where we are putting in a lot of effort to help people understand vitiligo. And there's just no way we can do this without receiving a medical aspect, the medical facts. So this session really is a myth-busting session. We want to bring you the facts about vitiligo. Vitiligo is a complex condition. I have had vitiligo for over 30 years. You can imagine how much it has marked my life. And so I know that it is very important for people to know the facts. Otherwise, they continue to live a very stressful life, a life of depression, and they are constantly trying to find solutions. So thank you so much for making the time for us to do this.
Thank you for also being here and helping out.
Yes. Dr. Malik, I've had only two dermatologists in my 30 years of vitiligo. And for half of that time, you've really been my dermatologist. Before that, it was another dermatologist who passed on, unfortunately. So I wanted us to start with the facts. What is vitiligo?
So vitiligo is what you call an autoimmune disorder. It's an autoimmune disease. So essentially what happens is your own immunity, your own soldiers that are meant to guard your body. So our body has a very complex immunity system. Our defense system is the one that protects us every single day from viruses, from bacteria, from all sorts of infections, be it fungal. It cleanses through the body. So now the skin is the wall of the body. So it's the top barrier that prevents things from outside entering. But within the skin, it has all these soldiers policing all through. Anything that is foreign, they have a mechanism of removing it. So the body has a mechanism. Either if something is foreign, it alerts. It has a mechanism, like let's say you have the coprons, then they will let the lieutenant know, the colonel up to the general. That's how it is. Then the general gives new orders, like, okay, call more help. Let's use guns. No, this won't work. Let's use missiles, destroy here, swallow this cell is so the immune system is so complex. It even has the ability to, if it sees that a cell is infected, for example, it just kills that cell. There are those soldiers that just, it has the virus in it, let's destroy it and get rid of it entirely. Now, by mistake, your own soldiers, your own immunity attacks the cells that make color and starts to kill them. So it thinks that they're foreign, they're not part of the body. So what happens, our body has markers, genetic markers. And that's why when someone gets a transplant, let's say you get a kidney transplant or a heart transplant, we must put you on medications that suppress the immunity for it not to attack someone else's kidney. So the body knows this itself. It has its own markers. So this time around, it sees those cells that make color as not part of it. So its job is just to attack anything that doesn't seem right.
Oh, okay.
So So imagine having your scurries at home just turning the guns on you.
On the children.
On the children, exactly.
On the family members.
Yeah. So this time they specifically attack the cells that make color. Yes. So those cells, we call them the melanocytes. So when the melanocytes are killed off, that's why you start losing color. So you start seeing a patient who is getting patches that are white and they're pale. Okay, I wouldn't say they're white. Okay, white would be the definition, but they're pink, more or less. It could be pink. And so it is totally harmless when it happens. And it keeps on expanding in some patients. But the actual cause of what really brings it about is really not known.
Okay.
But all we know is what you're showing is that autoimmune. Your own immunity just going against your cells that make color. Yeah.
So you said that what causes vitiligo is not known.
It's not known. There's so many reasons because, you know, when they do so many studies with vitiligo, they see that, okay, let's look at 100 patients. They're all totally different lifestyles. It comes on any age. So age is not a factor. Any gender, so it's not women or men only. Any race, so it's not blacks only, so you find it spread across. Lifestyle, so it's not about socioeconomic lifestyle that's, you know, people are well to do off or poor who are poor. So it has no clear relation that has been noticed.
Yeah.
So that's why we say the cause is really unknown.
Yeah.
And it can come at any age. I've seen patients who are just 3 months old and they get it, to those who are 8 years old and they just get at 8 years old. So it's something that is absolutely unpredictable, which I think we'll discuss further down the road. But yes, it is the cause. The truth is the real cause is not known. That's the final answer I can give.
Yeah.
There are things that are related.
Yes.
Connected with it.
Yes.
But they're not. So for example, so there's a genetic predisposition where they say that some people, they have that gene, that autoimmune disease gene. So you're predisposed to getting it. But then there's an environmental factor. There's an external factor that wakes up that gene, and then you get the vitiligo. So it's like a switch. So imagine you have this wiring done. It's been there. It's been intact.
Yeah.
But just that switch that just flips it on. So usually that switch that flips it on can be anything. It can be stress. It can be a drug that you've ingested. It can be another autoimmune disease. So there's a percentage of patients who have other autoimmune diseases that attack the joints. They attack the thyroid gland.
Like rheumatoid
arthritis, Sjogren's, thyroid disease. And you end up also having vitiligo. So, but everyone goes through stress, right?
Yes.
Everyone takes drugs, you know, medications. People do take any types of medications. But we've seen cases where someone's, look, it was triggered after taking certain type of medication. It was triggered after going through a stressful event. That's why I was saying the real cause is not known because everyone goes through those things, but you don't really know why. Otherwise, everyone will be getting vitiligo. If we say it is stress, everyone with stress will be getting vitiligo, which is not true.
What about, is it contagious?
No, absolutely not. Absolutely not.
Yeah, I think people need to hear that.
Vitiligo is not contagious. People always have that fear. They can't even give a handshake to someone who has vitiligo because they feel they will get it. They just
and then there are others who think that if I shake their hand, I'll become rich.
Yeah.
Someone told me that.
Okay, that's a good one.
Yeah, someone told me that.
Yeah, so that's not true, obviously. Well, does that mean that all people with vitiligo are rich?
Well,
or
we are yet to find out.
We're yet to find out. So it's not contagious. So if someone out there has a partner, they have a family member who has vitiligo, they will not get it. Because think of it logically, if I have vitiligo in the community, all the people I'm interacting with would still have got vitiligo. Then you have flu, everyone else gets flu.
Like my whole family would have
get exactly. That's the thing. So that alone should explain logically that it's not contagious.
Yes.
It's not contagious.
So back to that question, that thing where you said the gene and then a trigger to the body that causes it, then to start. When I look back as many generations as I can manage to, I've never known of anyone in my family with vitiligo. So does that mean that maybe the gene was there and it was just many generations down the road?
Yeah, so genetics is one of the most complex mechanisms anywhere in the world. It's so complicated. The way DNA plays roles is extremely complicated. You cannot even fathom how it works. Our genes are interplay of amino acids. So we inherit from a mother, from a father, and there's so many thousands of genes in there. And one small gene keeps on recurring. So it could be a great grand uncle from a mother's side. And there's a small bit of it that comes with a mother, with a father, from father's side elsewhere. So genetics is so complex. And also, that being said, studies show it's about just 30% where there's a genetic predisposition. It's about 30% where there's a genetic predisposition, where you can have family members who have it. And also that they're not directly connected. So studies showed twins, if you have twins and one of them gets vitiligo, the chance of them getting vitiligo is usually like 20%. So it's not a guarantee that this other twin will also get it, meaning it's not, you can't say 100% genetic. You get it? That's what I'm saying. It's so complex. So the answer comes back to the other issue is cause is really not known.
Cause is not known.
So they just look at patterns, statistics, but about 30% there's a genetic predisposition. Or 30% to have it. But the 70,
so chances
no one knows.
Getting vitiligo from your family are very slim.
They're extremely slim. Extremely slim. Like 0 point something of a percentage.
0 point something. And I think there's a time you mentioned that if you get vitiligo from maybe your parents or grandparents or wherever, if it's passed down in your family, it means that generally in your family you pass things down, like you pass down other diseases.
There are other diseases, yes. So the number of other autoimmune diseases that are genetic. So vitiligo, there's something about vitiligo. You may have vitiligo happening by itself alone as vitiligo, but then the other cases where vitiligo is part of a syndrome, it's just a symptom of something else going on in the body. So there are those cases where you have another disease which is inherited, but vitiligo comes up. For example, people can have what they call lupus, and then they get vitiligo.
People with lupus always get vitiligo.
Yes. So there are those autoimmune diseases, others that are genetic, but the vitiligo just shows up as part of that spectrum. So those two things are different. So vitiligo that shows up as part of a spectrum of other diseases. So it's different. That's why when I see a patient, I always screen for any of those other conditions that we may have to deal with. So ask ourselves, is the vitiligo, this patient has come with this standalone thing?
Or is it a reflection of
something else going on in the body?
Okay, that's why you always run several tests.
We run several tests. The autoimmune screens are extremely important. The other key thing that was seen in vitiligo patients is thyroid disease. So about 30 to 40% in some studies of patients with vitiligo, it was shown that the antibodies also, the antibodies, the immunity that was attacking the melanocytes also attacks the thyroid gland. So the thyroid gland is a part of your body. It's an organ. It's in the neck, just here. And what it does, it controls the levels of energy in your body. So if they attack it, you get thyroid disease. So either it's under functioning or it's over functioning. So we always recommend patients with vitiligo. Some of them, the thyroid disease precedes the vitiligo itself. Others, it shows up years down the road. So we recommend every 2 to 3 years for a patient with vitiligo to always screen for thyroid disease.
I need to do that.
So you do 2 screenings. You do what you call thyroid antibody screen, meaning we need to be sure that the antibodies are not attacking the thyroid. So the patients have seen, and we do the test, and the immunity is really hard on the thyroid. It's attacking it. But the thyroid is still intact. It's functioning well. Then there are those who come in when already it has been damaged by the immunity. So they get what you call autoimmune thyroid disease. So among all diseases associated with vitiligo, thyroid disease is number one.
Okay.
The percentages are usually higher. So it's recommended just to do a screen test every 2 to 3 years. Whether you have it today or not, in 2 to 3 years, it's unpredictable. That's the thing about vitiligo. It is unpredictable. Totally.
That condition, it just does what it wants.
Like you said, it has no rules. It doesn't follow any rule. It doesn't read any medical textbooks. So it does whatever it wants. How it spreads, which parts of the body it will affect, whether it's going to stay in the same area, who gets
what
it,
age,
it's
what
unpredictable.
race,
what
gender. And
so it is important for people to stop that feeling. Let me search for an answer. Why me? Why is it happening? The truth is, you will not find an answer.
And that search causes additional stress, which makes
it worse. Exactly.
In fact, I've noticed that most people's vitiligo increases more in the first years. Because you have not yet come to a place of self-acceptance.
Yes.
Of accepting your
you know, that is something so ironic. There are patients that I see, and I really take them through the whole journey. I do the counseling, but I tell them, look, we need to be sure that mentally you're okay. I always need to know that mentally we're okay. Why? When they come in, it's a small patch, and you start treatment, they anticipate it to heal, to recover, to repigment faster. So you tell them it's going to take, let's say, 4 to 6 months. Then they start focusing so much on that patch. When they see something changing, they start to worry. So then they build anxiety over the delay in healing.
And that makes it worse.
And it makes it worse. It just makes it worse. So they start now seeing more. They start seeing more lesions coming up. Now, the more they see one lesion, then they panic more. They start coming back, doctor, why are things getting worse? So they start feeling, they say, oh goodness, I started treatment and things got worse. It is the anxiety of the expectation of the treatment work. So I tell them, look, if you're going to go through this of expecting cure so soon, it's going to make things worse, unfortunately.
I agree with you. I think that on my own journey with vitiligo, in the first 10 years of my vitiligo is when I did most treatment. Of course, my mom, bless her soul, she was really trying to make sure that I get as much help as I could medically. So we tried so many treatments. And in those years, that was the hardest time for me. And I think 10 years in, I stopped taking anything, maybe even earlier. Maybe after about 7 years, I stopped every treatment. The next time I did treatment with vitiligo was when I met you. And I had vitiligo for 20 years at that time.
Imagine.
But at that, maybe more, I had it for about 20 something years. But I had it for about 25 years. But I didn't do any treatment for about 20 years. By the time I met you. And then in 4 months, you put me on phototherapy and tacrolimus. And in 4 months, all of vitiligo on my face disappeared. 4 months. I couldn't believe it. I was seeing repigmentation and I'm like, interesting.
Is this real?
But I really, honestly, I didn't really care if it repigmented or not. But I was pleasantly surprised. So tell us.
So it's because you are calm, I think, and restful. That's when the treatment surprised you. If you're anxious, waiting for results, it would have backfired.
That's true. That's true.
Backfired. Stress is a very big factor.
And so for a person out there who has vitiligo, the biggest thing is to first heal emotionally, like mentally, like you said. That it sets you on a journey of wellness. But you see, the thing is, it takes time to come to a place where you've said, okay, this thing happened. I don't know where it's heading. I don't know how far it will go, but it's okay. But once you come to that place, it may repigment or not.
There've been so many cases of spontaneous repigmentation. Spontaneous. Someone just repigments totally. It just goes away. And usually that comes with a positive mindset.
That's true.
Yes, so a positive attitude is one of the treatments for vitiligo. Let me just say that again.
That's
A positive attitude is one of the core treatments, if not the core treatment for vitiligo. So that's mental well-being.
That's true.
That is what helps a lot for
I
healing,
agree with you
for
100%.
treatment work.
I even have places that have repigmented without me doing any treatment.
Yeah. Patients who come in with vitiligo and it's the child.
Yeah.
I always, when they come in as a family, I tell them, look, we are not treating the child, we are treating
The
you.
parents.
We are treating you, we are treating the community. I am always frank with that. We are treating,
That
because it
person's
is about perception. The patient themselves, the actual disease will not kill them. They're not in any danger, any imminent danger to their life.
Yes.
What is happening is the social outlook, the perception, the beliefs, the fake beliefs, you know. And so when the family comes in, I tell them, we're going to treat you, the mom, and you, the
First of all,
dad. Bring the in-laws. Now, that's also another issue. I tell them, please bring the in-laws. We need to have a chat about this.
Yes.
And some, they do bring in the in-laws. They come in and then we have a frank discussion about the vitiligo. I told them, this is not about the child. It's you guys. Why? Every time the child starts seeing that, you're taking them to all the clinics, all the hospitals, everywhere, they worry more. The child start feeling that they are burdening their parents. Two, if the parents start crying, you know, the child starts seeing the mother crying, they start to blame themselves.
Yeah,
they start
like
to
I'm
feel it is
making
their
my mother
fault.
sad.
So they feel bad, and that affects them very, very badly. So imagine they're in a family, they have like other siblings, but all the time they're being taken to hospitals. So because people move all around, they go to all the facilities trying to look for treatments. So it becomes more of, it has a huge psychological burden on that child. And I tell them that you having a positive attitude, embracing it, making peace with it earlier, is what will help this child to also cope with it.
That's true.
So we focus on coping. Treatments are available. We'll discuss them. The treatments are there. But I always tell them two key things. Let's look out for any underlying conditions that need treatment, other autoimmune diseases, if they're all normal. We've checked other key things like vitamin B12 levels, iron levels, vitamin D, and they're all normal things are okay. They don't need to be, you don't need any supplements. Then we focus on coping mechanism, because coping is important. It will allow the treatments to work. If you don't cope and mentally not okay, all the treatments in the world will not help. No matter where you go,
That's true.
they will not help. They will not help as long as mentally you're not okay.
Yeah.
So with parents, it's them who have to be mentally all right. Yeah.
When I got vitiligo, I was 10 years old. And to be honest, I didn't care at that age. I was like, it will go. I don't know what this is, but it will go.
Yeah.
And I started to stress about it when the external world started to react to my vitiligo.
Yes, exactly.
And so I think it's a good thing that you start with their community, the parents, the family, and all of that. The teachers.
Very, very important. The teachers at school.
Yeah, which is why we're doing this education and awareness, because if you hear everybody's story, the biggest stress comes from the external.
The external.
And so I want to follow that with this question. In Uganda, people believe that vitiligo comes from being burnt by twins. Where does that come from? It is the most annoying thing. You can say to someone who has vitiligo and is on treatment, they've seen a doctor, but what's that? What's that about?
It's a myth. It's a cultural belief which is extremely wrong. But unfortunately, Africans, we are cultural people. So culture is part of who we are. It's part of who we are. So sometimes it's good to embrace it and understand it. But we have to talk about the key issues that we know are myths. So the misbeliefs, the wrong beliefs, it's one of those high on the list. It has absolutely no relation to twins burning you. So I don't know how that
hope you
story
have heard
started.
people-
I don't know how it was a legend or something.
It is so bad.
I wonder which culture side is it. Was it the Baganda culture?
And they
Was
spread
it
it
from
across.
the east? Was it from the west? I think we will never really know.
But it is quite annoying. I grew up listening to that for so many years. Like, that is where the biggest part of the stigma comes from.
Yeah.
And then also people approaching you and telling you, oh, this is what happened to you. And, so it's important for people to hear this.
The stigma is so important. We need to fight it. If you're a teacher, you have a child in class who has vitiligo. If you're a parent, you have a child who has vitiligo. If you're an adult, if you have a spouse who has vitiligo, please do give them the support. You will not get it. What they need from you is your love, support, patience, and understanding. Not your anxiety, your panic, and your beliefs. Because the more negative, the more anxiety you show them, the worse their condition will get.
Yeah.
So always make sure that you have a positive attitude. It's very, very, very important. So the whole community needs to know it and understand it. So the more we spread the word out there to understand it's an autoimmune disease and cause is not really known, it's not contagious, then over time, I think it will help us to break those barriers. And then it will help vitiligo patients to get better.
Yes.
So because it's the other way around, So the community needs to understand it, then the patients also get better. Why? Because people will stop asking questions. When they stop asking questions and feeling something is wrong, then the stress levels will be lower and then the patients will be able to heal.
It's one of the beautiful things that social media has done for us, because you see it online everywhere these days. Of course, the campaigns that we are doing every year, but also generally, I see people with vitiligo on Instagram and they're doing their makeup or they're just living life. I'm like, okay, people are getting sensitized to it. And also the younger generation now, the Gen Zs, more like the Gen Alphas, the teenagers, they actually like vitiligo. They feel like it's beautiful, the patterns are beautiful, but it's because they've seen it and they've not had those weird myths. And so people need to know, you don't need to do anything to get vitiligo. It's not a punishment for anything. It just happens.
It just happens, yes.
Yeah, and then the other thing I would like to ask, are people born with vitiligo?
No, people are not born with vitiligo. We call it more of an acquired disease, meaning you get it after being born. So people are not born with vitiligo, unless you try to mix with other diseases that look like vitiligo.
I think so.
But we don't get people who are born with vitiligo.
Yeah, because there are people that say to me, no, but I know someone. And I'm like, that must have been something else.
It must have been something else.
Yeah.
We call it an acquired autoimmune disease. Yeah.
And then can people's vitiligo be treated and it reverses and they completely repigment?
Complete repigmentation is rare, but it can happen. The case where it has happened. Now, repigmenting depends on the body part that's affected. So the face always recovers faster, followed by the neck, followed by the trunk, and the parts that are hard to repigment are the hands and the feet. So essentially what happens is, no one really knows why the hands and the feet, but the palms and the lips are very hard to repigment, because what happens, what we discovered is that when the immunity attacks and the melanocytes disappear, they run, they actually hide, they get sanctuary in the hair follicles.
Yes.
So when you're healing, so the treatments we give, they suppress the immunity, they stop the immunity from attacking. Then the next step is stimulating the melanocytes to come back. So they migrate from the hair follicles and outwards, and they spread again, they regrow and multiply. So parts that don't have hair follicles, that's the lips and the palms, the feet, they're always hard to repigment. Those ones are hard to repigment. But a repigmentation rate of 50%, 60, 70 is good enough. However, vitiligo is unpredictable. You repigment today, there's no guarantee that 5 years later it will not come back all over.
Come back.
Yeah, there's no guarantee.
You're right.
That's why we say vitiligo does not have a cure.
Yeah.
What it has is treatment,
Yeah.
but not cure.
And also, if you've had it and repigmented, chances of getting it again are very high.
Extremely high. Any small thing,
it can start again.
It can start again, yes.
Yeah, but again, not to be
because
afraid.
it means you are predisposed already.
Yes. But there are some people that repigment faster than others. So you get a lot of that from people, oh, my auntie had it and everything went. Sometimes it went in the places that are visible to you.
Thank you. That's what I was going to tell you.
Yeah.
Most times it has gone on the places that are visible.
Yeah.
Yes.
Like if somebody knew me as a child and they see me without any makeup, they'll think I healed. I still have vitiligo on my lips. And a bit around my lips.
Yeah.
But when I saw you in 2015, the vitiligo I had for about 20 years, you treated it in 4 months with phototherapy and it all disappeared. And actually, a lot of it had actually gone. Even my elbows.
Yes,
were,
actually, I
by
remember.
the wedding, they were mostly repigmented.
Yes, I remember.
But again, other conditions can cause it.
Yes.
Because remember, after the wedding, I stopped all treatment because I got pregnant.
Yeah.
And I didn't do any treatment for that whole time of pregnancy and breastfeeding.
Yeah.
And then it came back, even on the face.
Yeah.
And then after I had finished breastfeeding, I came back. Remember, you were actually convincing me that you can continue your treatment when you're pregnant, but I was afraid.
Yeah.
And then you started the treatment again. And again, it completely repigmented. And just the lips were the ones that were not repigmenting. And then again, after
because of that reason, for the lips,
then I got pregnant again. And in that pregnancy, breastfeeding season, again, it came back. But I wasn't afraid. I knew I can treat my face and it will come back. And I did. And so just to encourage people out there who have vitiligo, especially on the face, the face repigments much faster.
Much faster.
Come to Unity Skin Clinic. Do the phototherapy treatment. You have a lot of options and we are going to talk about them. But for me, phototherapy is the one that works for me.
For you,
And every time I see, seems to be, the other thing I noticed is that if a patch has not completely repigmented, finish the treatment. Make sure it has completely repigmented because areas that have not totally repigmented, most times that's where the vitiligo comes again.
Yes. You must make sure that they're completely.
The goal is to completely.
Yeah.
And so tell us, what treatment options do you offer at Unity Skin Clinic?
So the treatment options that we offer, I think the first and the most important treatment is counseling. I should say that's the most important treatment that I love offering.
Yeah.
It's the counseling, it's the coping mechanism, it's the traversing through the family. Yeah. That's the first thing. Then, of course, we need to rule out any other comorbidities, other diseases that could be related. So we're asking ourselves, is it standalone vitiligo or the other diseases? So we go hunting for them. If we find them, then we treat them as well. Because usually, so when the vitiligo is as a result of those other diseases, if you treat them, then that vitiligo also recovers. Yes. But if it's standalone, then we can discuss the treatment options. So over the past 13, 14 years of my practice in dermatology, I've tried so many treatments. And the things that I've seen really working that are core. One, when a patient comes in, we ask ourselves, is a vitiligo stable or unstable? Unstable vitiligo is one that's changing and evolving very fast. Stable vitiligo is when it has been in the same place for 1 year. It has not changed at all for 12 months. Then that's what you call stable vitiligo. So the other type, we call it symmetrical or asymmetrical. Is it on one side of the body or it's both sides of the body? Now, the vitiligo that is on both sides of the body. So if they have it on both sides of the eyes, the nose, the hands, that symmetrical vitiligo spreads really fast. But it responds to treatments faster as well. But the one that is asymmetrical, or what we call segmental vitiligo, for it, it's slower. So you just have it on one part of the body, but healing is also harder. Yes, healing is also harder for it. It takes a bit slower, longer to heal, but it tends to be more stable as well. So the one that tends to be more stable is when it's both sides.
Like someone just has a tiny patch here.
Tiny patch, and it's
like
just
that
there
for years.
For years, yes. That's what we call segment of vitiligo. It's just a segment of the skin. So that has a habit of being stable. So depending on if it's unstable and the patient has come in and it's really evolving fast, the first thing we give them is treatments to stop the immunity from attacking the skin. So there are several options that we give them. We give creams on top, and we give them tablets as well that they can swallow. There are different types of medications that we can give them. We call them immunomodulators. I don't like using the word immunosuppressants, but what I would call it immunomodulators. They help to calm down the immunity system so it doesn't overact.
Yeah.
So you have to give them that treatment for long enough, for several months, to make sure that it is not continuing to explode, to flare up. Then once it's stable, then you can look at other options. So we do phototherapy. So what happens is the first step is stop the immunity from attacking. That's 50% of the job. Then the other 50% stimulate the cells to come back that make color. How do you stimulate them? By sunlight.
Yes.
That's the other key issue. So sunlight, our skin responds to the sun. Melanin was created for sunlight. It evolved because of sunlight. God gave us melanin because of the sun radiation. So what happens, why in Africa we are darker, especially like in Uganda, we're on the equator. So we're directly close to the sun. So the radiation dose is very high. That's why we are darker. So our melanocytes respond. The more they expose to sunlight, the more melanin they will make as a protective mechanism. So they're highly responsive. So unfortunately, what happens is a patient with vitiligo has vitiligo, but then they go into hiding. They stay indoors. They start avoiding the sun.
Yeah, or they cover up.
They cover up.
Yeah,
not knowing that actually the sun is the wonderful treatment for them, because it will stimulate the cells to come back. Then the other key issues that the misconception of thinking that when I get exposed to the sun, I'm going to get skin cancer, or because I don't have any melanin. It has not been shown at all that people with vitiligo are prone to getting skin cancer. So the sun is good for you. We don't recommend going into the hot scorching sun. The sweet spot is 9 a.m. to 11 maximum, or from 8 a.m. So 8 a.m. to 10, the new sun, and then later in the evening. So from like 4 p.m. onwards, not the direct scorching sun. Yes, so that sunlight, it actually helps a lot. So if you give you treatments that stop the immunity from attacking, the cells need to come back. So what we have here is what we call phototherapy, which is light therapy. So it's a form of artificial sunlight. So studies showed that there's a specific wavelength of the sunlight radiation that was shown to actually treat vitiligo. So it was a specific bandwidth in the spectrum of the radiation of the sun. So the sun has so many rays, so many different types of radiation that it emits. But this one is specific. It's called narrowband UVB. And it's a specific wavelength. So they created machines that can generate that specific wavelength that comes from the sunlight. So they are focused treatments, and they're the ones that help to stimulate more color to come back. So you need to have phototherapy in addition to the medicines that stop the immunity from attacking. So we go through that. There are other treatments, we call it excimer laser as well. So still is still part of light. That helps. If it's stable, if the vitiligo is stable, we think of grafting, micrografting. Now we can go surgical on that. So it's a skill that we specialize in here at Unity. We extract small bits of skin in the normal area that is pigmented, and we implant them in the part where it is depigmented. So it regrows very well. But even with it, when we implant in the affected part, we still put you on phototherapy.
Okay.
That has shown to
trigger
the response,
melanocytes.
Melanocytes, yeah. The other one is called stem cell, melanocyte stem cells. Stem cells are the best cells in the body when you're an embryo in your mother's womb.
Yes.
They're the ones that turn into all the different organs.
Yeah.
Into the skin, into the brain, into the liver. So it is discovered that we have stem cells in other parts of our body. The ones that turn into other parts. In the bone marrow, the ones that turn into blood, under the skin in the fat, and then in the blood itself. So we're learning new techniques of extracting those stem cells and injecting them directly where it's affected, and they help to regenerate new skin that is not affected. That's now the future of medicine.
Nice. And treating almost everything.
Everything, exactly. Yeah. So it's something that we're also looking forward to bring here at Unity, to be first of a kind in Africa.
Nice.
But so there are other aspects of treatments that are coming in. We have what we call biologics, that are targeted therapies. So they extract from other living tissue and they get things. So with advances in what you call molecular medicine, nowadays every single disease is mapped to the detail. So they go on the molecular level and know, okay, when someone has vitiligo, what is wrong? We know that it's the melanocytes, but hey, what exactly is wrong with the melanocyte? Oh yeah, we know that it is on the top of the melanocyte. What is wrong on the top of the melanocyte? There are some anchors. What's wrong with those anchors? They have some small molecule that is attaching, that doesn't attach. Then what happens? So it doesn't attach, then something. So they're studying mechanisms of diseases and they're having what you call targeted therapies. So they get to know the pathway, how a disease develops, and they get the treatment that targets only that chain reaction. So those therapies are called biologics, and they're coming out, they're new. So they help to minimize side effects. The older generation of drugs, when they're suppressed, they mean to suppress the whole body.
Yeah.
But these ones, they're making them that this is for vitiligo. We've understood the pathway, how vitiligo develops. We target one part, and in the immunity, the part of immunity that is attacking, that small thing, we get something that stops it and they heal. But biologics are extremely expensive. Currently in Africa, they're so hard to get. They are really expensive. Yeah. Like, the word I can use is exorbitant.
So are they?
The prices are crazy.
Is that being done anywhere else in the world?
Yeah, in the US, they're there. Most of them are developed in the US. So actually the US is the first to get those biologics. Yeah, so they're newer drugs.
So people that can afford.
They can always go to the US and get them. Then also some of them are available in Europe. But yeah, the prices are really exorbitant for now, for the common person.
Yeah.
But phototherapy still goes a long way. But remember, still, all those drugs, they don't provide a cure. They're all treatments.
Oh, okay.
They're not guaranteeing you that you'll not get it again.
Yeah.
Very important.
But you won't get new patches.
You won't get new patches.
But at least they help to manage the repigment.
Yes. They help to repigment up to like 70 or 80%. So they help with that. And remember, if you're mental being, if you're stressed, you're not sleeping, you're too stressed, all these biologics still will not work. I've seen patients who've taken them, who've gone on those expensive treatments and still things didn't work. Yeah.
Wow.
Yes. So that's how we treat. So the well-being is extremely important.
Yeah, I think you said something there about sunlight, and a person who has vitiligo and is at a place in their life where they are okay, not being hidden, they've healed. So already they are well on the inside, so much so that they can walk around without covering. Then most likely they repigment because there's a mix of the sunlight and the wellness.
Yes, it does help them a lot, especially on the face.
Yeah,
it does help. It goes a long way. So if you have vitiligo out there, don't be shy to go out in the sun, in the sunlight, and get exposed. It does help to repigment.
In my early years, some of the treatment I got that was actually very effective was from Egypt, and there was one called meladinin. And you would apply it. It was like a liquid. Yeah. It smelled a bit like a sharp alcoholic.
Yes.
Like a spirit.
Yeah.
But you would apply it, and then you would have to sit in the sun.
In the sun,
exactly. It would have to be the morning sun, like when the sun is rising and it's not very hot.
Yes.
Sit there about 30 minutes, and then before you know it, Sometimes I would get sunburned
Yes.
because of now the rest of the day you're picking up sun.
Yeah.
But when it would heal, that's where
See
the pigment would
repigmentation,
start.
So that's what we call chemophototherapy. So those are drugs that can be given in conjunction with the light therapy. So all they do when they put that cream on that area, it concentrates the sun radiation, focuses it on that part, and then it heals. So the older generation of phototherapy involved being injected or swallowing the tablets, taking that medication, then you go on the machine. So but now all that it was superseded by just the newer generation of treatments that are direct, just that specific wavelength that triggers it off.
Okay.
So we used to have that. So that also used to be a good option.
Yeah.
But they are uncomfortable, inconvenient. So just even that good old sun exposure.
Yeah.
Yeah, if you can't afford it, if you can't access the creams, it's also very good. It's also good enough.
What about food? Are there foods that help support recovery or repigmentation, or are there foods you should avoid? There was this myth, I think it's a myth. There was a time I was told that do not eat fish because when fish and milk, because when fish and milk mix in your body, they make vitiligo worse. And that concept came from India. It's the Indians that
So
did
I'll tell you
that.
something. Culturally, though we have things in Africa, India also, they have a
Their own
lot of
thing.
cultural beliefs when it comes to vitiligo, a lot of cultural beliefs. So the Indians also, those who have vitiligo, it's a huge community there. And they also have that stigma to a very extreme extent. Yeah. So for us, in terms of foods, there's no relation to diet. Like you'd mentioned, Japanese have a different diet, but they still get vitiligo. A Mexican has a different diet, a Brazilian has a different diet, a Ugandan has a different diet, a Zimbabwean has a different diet, an Egyptian has a different diet. Mediterranean people have a different diet, but they still get. So among the nutrients, what was seen, the Indian community, the vegetarians, they were having slightly higher proportion of people getting vitiligo than the rest. And what was discovered was because they were having vitamin B12 deficiency, which is usually animal derived, but they are more on a plant diet, so they're vegetarians. So they realized that slightly higher percentage was getting it. So they recommend supplementing. So that's why we test for vitamin B12 levels and then also vitamin D.
Yeah.
So that means I'll give you things that are rich in vitamin D. Yeah. However, if I do the tests and they're normal, then I don't need to give them to the supplements. If I do the tests and they're not normal, they're
Then you
low,
need the
then we
supplement.
can supplement, and that has shown to help. Some patients have done well with supplements, vitamin supplements.
That's right.
They have, but I've seen patients traverse that journey over a decade. They still relapse.
Yeah.
What I think, so they take supplements that have a combination zinc, vitamin D. Some of them have iron. Others have selenium. And at first the patient says, wow, I'm repigmenting, the supplements are working. At the end of the day, I ask myself, could it be the positive attitude?
That's also possible.
That is
when you see
helping.
yourself repigmenting.
That they get that energy. They come, doctor, this has really helped. It works.
Yeah.
But then 1 year later, they're like, oh yeah, it just came back.
You know, it's funny.
Supplements, studies are there. They say they do help.
Yeah.
But it's not really standardized. So don't punish yourself if you can't afford to swallow those supplements. They're expensive, they're not cheap.
Yes.
Especially the ones that have selenium.
Yeah.
Because you have to be on it for a long time for you to see any effect. So because they're expensive, don't punish yourself. So my goodness, my vitiligo isn't going because I'm not taking the supplements. No. They may still not work. It's not a guarantee that they will work. Yeah.
You know, when you say that, I remember when I was a child, when I had just got vitiligo, the first treatment I got was vitamins. But I didn't know which vitamins, I can't remember.
Yes.
But I've also seen a lot of people comment on social media, say, oh, vitamin D,
Vitamin D, vitamin D, vitamin B,
vitamin K.
vitamin
I don't
K,
know.
they put selenium, they put zinc, magnesium, a lot of things.
I think sometimes they just make your body well.
Yeah.
and then your body starts to respond a certain way.
Exactly.
Yeah.
They may help with the stress levels.
Yes.
They may help with the hormones that has, like serum cortisol if it's so high.
Yeah.
So it's a number of reasons, but it's not a direct link. So don't take it from us that the doctor said you must take the supplements.
Yeah.
Yeah. A normal healthy diet is good enough with it.
Yeah. Yeah. Okay. I think you've answered most of the questions.
Yeah. Thank you.
And maybe one message you would have for people who have vitiligo in this June 2026.
The one thing I'll tell patients with vitiligo, one, you are not alone. The vitiligo will not kill you. What we are treating is your friends, your family members, your community. We are not, the problem is not with you, it's with all those who are around you. We'll be treating you for cosmetic purposes, but take it from me, you will never die of vitiligo. So don't stress over it. The cause is not known, but what we can do is can help you to traverse and cope with it and provide treatment. So vitiligo has treatments, but not cures. Those two are different. A cure means it will go away forever, it will never come back 100%, but it is treatable. We can treat it, and it gives you that part of having a good life. But coping with it, handling the stress levels is the most important aspect of dealing with your vitiligo. So don't feel alone out there. Don't suffer in silence. Talk to someone, talk to Cerinah, come and talk to us. We can be able to guide you, can be to help you so that you can be able to live a better life.
Yeah. Thank you for that. Actually, you're really spot on. Our theme for the theme that we came up with, the world theme, for this year's Vitiligo month is Vitiligo didn't kill me, made me. If anything, very good things can come out of having vitiligo. Like I started a business. Vitiligo will change you on the inside and make you a better person if you embrace it positively. So, we are putting in the effort to educate the masses because we believe that once people have the right information about the condition, they will respond better to people when they get it. They'll be able to offer the right support. But also for people out there who feel like hopeless and all, just know that you're not alone. Like you said, be encouraged. Hope you can find hope. We're sharing a lot of messages on social media. Please check out the Serene Beauty channel on Instagram, on TikTok, and just find many strong women. So people will say, is it why only women? They are the ones that are my friends and have vitiligo and are willing to share. But there are also men who have it. And the men really struggle because, like
men are meant to be silent.
They don't talk about their problems. They don't look for community to go and pour themselves out. And they just soak themselves in work. And sometimes the combination of all that stress and work and everything just makes it worse. But find a community, find people. My community was played a very big role in my healing journey. Just people loving and celebrating you and making you just forget that you have this thing. It's really not the worst thing that can happen to you. So just be encouraged and do what you can. My personal belief is get the treatment. But if it doesn't go, it's not the end of the world. It can still be well. Thank you very much.
Thank you too.
It is my hope that when people watch this, they will be better educated. And if you want to learn more, Unity Skin Clinic is here. They really are offering the best treatments for vitiligo in Uganda right now.
I think the month of June you're offering free phototherapy as well.
Yes.
So let's see if the demand is there. Maybe we can push into another month. But phototherapy is free of charge here at Unity for this whole month of June.
Thank you. I hope you can make that an annual offer every June.
Usually it's annual actually. We make it annual. We try to make it annual.
Free phototherapy. At least people can try it. Then they will be surprised.
They see exactly.
Honestly,
get to know what
for
it is.
1 month you do free phototherapy, combined with tacrolimus,
the medications,
you will definitely see some repigmentation. And that could be the start of your journey towards repigmentation. Thank you very much.
Thank you too.